Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi everyone, we are back for another episode of Smile Sisters.
That's right. Today we want to talk about gum disease, specifically as it's associated with your wisdom teeth. Because the wisdom teeth are an area where gum disease is actually much higher than other parts of your mouth.
Yes.
And this is totally predictable because it's very hard to clean and the teeth are not normally lined up perfectly straight. So they come in at an angle and create like weird pockets with your gums. So in study after study, it's been shown that you have deeper pocket probings, which means that you have more swelling in those areas and you have more bacteria around your wisdom teeth.
So potential for abscesses, like infections to happen around you, which is one of the main issues with partially impacted wisdom teeth.
That's right.
Wisdom teeth that are half in, half out. Maybe they're coming in at an angle. So they're kind of stuck. They can't fully erupt or come into your mouth straight up like your other teeth.
Right.
And so these pockets, weird pockets, happen around them, and these can kind of swell up and get infected.
Yes.
And this is what often drives people into our practice because they're having a gum infection around their wisdom teeth.
Well, we had a patient, I think a week ago, and she came in with a wisdom tooth infection, a partially impacted wisdom tooth, like what we're talking about, as half in and half out. And she couldn't even open her mouth. Like she couldn't even put her pinky in between her front teeth.
Right.
That's how little she could open because it had gotten so infected. And when it gets that infected, your muscles can actually spasm.
Yes.
Like your jaw muscles will just like spasm
Clench
and
up.
clench. And she couldn't even open her mouth. So thankfully, she was able to like swallow pills, which is antibiotic pills.
Right.
So she started on antibiotics, and it's extremely painful, I mean, it's shocking. Like you wake up and you can't open your mouth.
Yeah, and very scary. And this is when that infection spreads from just being local, like just in the gum tissue around your tooth or whatever, to spreading into kind of your bloodstream as well. So often you have a fever, you're feeling sick, maybe nauseous, you just not feeling well, and then you can get really swollen. Usually the swelling happens on the outside, but it can happen on the inside and actually be life-threatening as well.
Yes, because actually around your neck, there's a lot of soft tissue. So there's really only your spine. Everything else is soft, like in front of your spine. You have like all these blood vessels, you have your, trachea, your breathing, everything is just there. So because there's not a lot of bony structures preventing this infection from expanding, you can easily get that infection to the point where it'll actually block your breathing.
Yes.
And one of the signs of this is if you start drooling. So if you have an infection in your jaw and you feel like you're drooling, that's a huge sign that you need to go to the emergency room and get on IV antibiotics. Because this means that you're not able to like properly swallow your own saliva.
Right. This is blocking your ability.
It's blocking your ability to swallow and breathe. And it can be like life-threatening in some cases.
Totally.
So these are extreme cases, but just everybody who has an impacted third molar is likely to have periodontal disease.
Yes. And it's not really related to how good you are about cleaning your mouth.
Not at all.
You could have no cavities, no gum disease anywhere else. But if your wisdom teeth are impacted like that, they will almost always have gum disease around them because it's just, the pocket is already there. It's not even necessarily that you're not cleansing it properly.
Right. It's just, you can't cleanse it.
Yes. And then the question is, if you can't get in there and clean it properly, then there is much higher potential for an infection to happen in those areas.
Yes. So again, this is one of the main reasons we recommend removing your wisdom teeth is to avoid all these periodontal issues. So the best time is when you're like at late teens to early 20s, I want to say, is kind of like the average age where we're removing wisdom teeth, because you're still not developing these periodontal issues. The teeth may or may not be fully formed, but they're still like younger teeth. You are younger, so you
feel
are
better,
healthier. Hopefully you're not smoking. And that's another issue that I see is just crazy. Like last week, I was not able to sedate this young man. And he was young. He was like 22, 23. But he's just such a heavy pot smoker.
It alters the ability to get sedated.
Yeah, like I was just giving him, what I normally give. And I wasn't able to get him sedated enough. So I had to refer him out to like a hospital-based situation where they could like really put him out. And, these, like pot, I'm so happy that, marijuana is legal, but I feel like our young population is just, some people are just like smoking it like on a daily basis.
Oh, sure,
and huge amounts. And all these things will affect, forget about your wisdom teeth, like your overall health is like hanging.
But even if you're coming in for a filling or something, sometimes it's hard just to numb those patients.
Yes.
It's just, they just don't react the same way.
Yes,
so it's difficult to do dental work on someone who is very stoned.
Yes, and I've never seen, I don't know about you, like in 24 years that I've been practicing, I've never seen so many young people on anti-anxiety medications and, all this like, and pot and all this kind of stuff. And all of these contribute to your dental health as well. There's nothing that you're putting in your body that isn't affecting your mouth. Like your mouth is part of your body.
Yes.
So what happens when you're on a bunch of medications? You're gonna get dry mouth. Dry mouth is associated with higher degrees of caries and also higher periodontal disease because it's decreasing your salivary flow in your whole mouth.
And your saliva has protective elements in it that fights bacteria in your mouth.
That's right.
They're like defense.
And if you've ever smoked pot, you get dry mouth. Like it's a common side effect of marijuana. Right. And all of these things can exacerbate and make worse the existing periodontal disease that is already there. So you're going to be like more likely to get flare-ups and things like kind of like get bigger. So all this to say prevention. So when you're younger, hopefully you're not smoking yet and you're healthy, that's the best time to take them out because we know they're going to create problems down the line.
If they're coming in and we know that there isn't going to be space for them. Now there are people who have the jaw room for their wisdom teeth, so the wisdom teeth come in straight like any other tooth in their mouth.
Yes.
And then there's no reason to remove them. If they don't have cavities, they're coming in straight, they won't have gum disease around them, that's any different from any other tooth in your mouth, and you can hang on to them. So it doesn't mean that everyone needs their wisdom teeth out. But if they're cavitated, they have infection in them, because that's another issue is often people aren't brushing their wisdom teeth properly because they're so far back in their mouths.
Right.
They're not cleaning it. So they might not have any cavities, but then their wisdom teeth are like
have
totally
cavities.
bombed out.
Yeah, exactly. It's like the one tooth where you have a cavity because you just can't clean it
and
properly.
You're just not taking care of it.
Yes. So if you see a dentist and they tell you it's coming in at an angle, you're young, you're healthy, this is one of the few surgical procedures that we can choose when to do. And let's choose to do it when we're younger and healthier. Let's not choose to do it when we're like 60 years old and, on a bunch of medications. And that's a really, really much tougher situation.
Apart from the gum disease and the issues around your wisdom tooth, that can affect the next tooth in front of it.
Yes. So that's another problem that we see. But this is not in our younger patients. I would say this happens more in your late 20s to 30s, where the wisdom tooth has been kind of stuck at that angle for like, let's say a decade. You haven't been cleaning it because you actually literally cannot clean it. It's impossible to get down there. So what's going to happen? There's going to be a cavity in the tooth next to it. And a lot of times people come to us because the tooth next to it is hurting now because the cavity got deep into the nerve. But it's not because you weren't brushing and flossing. Like you literally cannot reach some of these areas.
And it really compromises the other tooth because often these cavities on the next tooth, so the tooth right in front of your wisdom tooth, they're like on the root of the tooth, like under the gum line on the root. So they're super inaccessible. So then we are not able to properly fix those teeth. So it can actually impact the prognosis of the next tooth, which means the chances of the other tooth surviving.
Yes.
Because your wisdom tooth was impacted and kind of sticking next to it for a decade or whatever.
Right. So all of these things. And then to prevent this periodontal disease, so once you get periodontal disease around your wisdom teeth and you have bone loss in the areas that are the furthest back in your mouth, it's actually very, very hard, even I would say maybe impossible to bring that bone back.
Yes.
So once you get bone loss around these back molars, and study after study, they've tried all these different things like grafting it, putting, bone graft in there, different suturing techniques, but there hasn't been anything to show that we can actually bring that bone back. So
Right.
some of the damage is actually irreversible. Like we cannot
Sure.
bring that bone back. So your last molars are going to have less bone around them.
Yes, and that's another issue. So
Yes.
cavities on the next teeth and bone loss around your next tooth
Yes.
can be real consequences of your wisdom teeth. So sometimes people say, I don't need to take them out. They're not bothering me right now.
Right.
We tell them they're impacted. They're half in, half out. Why don't you take them out? Well, they're not bugging me. Why should I take them out?
Right.
But the fact is that issue is going on. And if you wait, then it can have consequences that are irreversible down the line.
Yes, and they are. Like no study has shown that we can actually bring the bone back to where it was.
Sure.
So anyways, if you want to know more about wisdom teeth or if you want to do a free consultation with us, you can go online, ladentalclinic.com. You can book a virtual consultation. We would love to chat with you.
See you next time.
Okay, bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.